So welcome to our first ever virtual, but actually about our fifth or sixth annual Fellow Education Day as part of the Oncofertility Consortium. And I'm very excited to meet everyone, even though it's in our strange new world here. Just by way of introduction, my name is Divya Shah. I'm faculty in reproductive endocrinology and infertility at the University of Pennsylvania. And I'm running it with...
Hi, I'm Wendy Vitek. I'm also a reproductive endocrinologist at the University of Rochester Medical Center.
So the two of us have spent a lot of our academic time sort of in the medical education world, and in that regard have been working for several years with the Oncofertility Consortium to run a Fellow Education Day. Usually we do it in November because it's when the annual meeting was. Obviously, things for those of you who are interested in attending our annual meeting, hopefully you know that that has been moved to the springtime. It's going to be in Pittsburgh in spring of 2022, but since that was a more recent development, we have retained our November date for Fellow Education Day, and we're happy to have everyone join us virtually. One of the exciting things I think this year is that maybe given the virtual platform, we have a much higher level of participants, and we also have trainees, many of whom are fellows, but some of whom are even a little bit earlier in their training, both nationally as well as internationally, and through many fields of medicine. So everything from pediatric and adolescent gynecology, endocrinology, oncology, urology, surgery, people who touch on fertility preservation in many different avenues. So I think most of you have seen the course objectives. We kept them broad, but we're going to be a little bit more specific when we get to the actual topics. But we definitely want to touch upon many available options for fertility preservation on the embryo, oocyte, ovarian tissue, sperm, testicular, and testicular tissue cryopreservation. We'll always also focus a lot on sort of the complexities and the individualization that is required when making treatment plans for patients really in whose fertility is potentially compromised through a variety of not only oncological, but also non-oncological means. And then I think, as I just spoke about, I hope that at the end of today, you guys will really be able to appreciate and actually engage with how interdisciplinary and collaborative this field really is and really needs to be to provide the best care possible to our patients. So this is a little bit of what the day is going to look like. I'm going to spend a few minutes now talking about the course, how the structure is going to work. And then we are going to get started with our first speaker. I think one thing that you will see and definitely appreciate in a couple hours is that this is not a passive course. So there are going to be some several excellent speakers, all of whom have been selected because of not only their expertise, but their efficacy as educators. But the speakers, by and large, are going to speak for no more than about 30 minutes. We are also going to do some team-based learning in interdisciplinary groups. So we're going to use the breakout rooms. You guys are going to be talking a lot without us and then a lot with us as well. For those of you who are unfamiliar with team-based learning, the basic principle is that there is a little bit of work that is done on your own before the session. Hopefully everybody got the email from Jenna earlier with a couple of readings that we asked everyone to do. Some of you may have already been familiar with one or more of those articles. Some of you may not have. And the goal of that pre-work is really just to get everybody to a baseline level of knowledge such that they can meet then in the classroom setting, which is going to be today in our learning groups, to apply that knowledge. Now, if you're going to be a stickler about it, team-based learning actually does start before we do case-based learning with a series of exams, but you get off easy from us. We're not going to do the readiness assurance test portion today just because of the virtual format. So we're going to have you rely on your before class readings, and then in class together, we're going to do some application exercises. So hopefully all of you read just a couple documents that we asked you to. And we just point out that in addition to whatever preparation you did specifically for this course, many of you have seen and through your clinical experiences and your training, you've had experience that you're already bringing to the table for these discussions based on your training to date, the patients you've seen, the other textbooks or other mechanisms of learning that you've already engaged in. So you've already done a fair amount of before class preparation. And when we get to the team-based learning cases, we're going to ask you to apply that. And the principles of the application are that we are going to pose some problems. Every team is going to work on the same problem at the same time and discuss it amongst yourselves. And then we'll reconvene as a big group. We'll get to the structure of that a little bit later in the day and ask you to commit to an answer or answers, report those answers, and then we'll have a discussion. That's usually the way that it works best. And these are real world problems. Most of the cases are written based on actual patients that Wendy or I or our colleagues have seen. So hopefully we'll find it, hopefully everybody will find it helpful, applicable, and hopefully it'll spark some discussion, because as most of you have appreciated, the real world doesn't have nice, neat answers. And so there's rarely one right way to do things. And we hope that we can instill that in everybody right now. So before we get to our first speaker, I just want to do a couple of housekeeping things. So all of you guys this morning, just a few minutes ago, should be getting an email from Jenna with the actual team-based learning cases. The questions are there for your group discussion. Obviously, there are no answers included because we're going to reconvene as a large group to discuss that together. So I just wanted to alert you to that email. We intentionally just sent it out a few minutes ago, and if you can, it's sent as a PDF. So if you can save that on your laptop or whatever device you're going to be using when you do the team-based learning, that would be perfect. And we'll refer back to it when we get to that portion of today. Okay, Wendy, anything else you want to add logistics before we introduce Dr. Gross?
No, I think we're all set. Thanks for the introduction.
Okay, perfect. Jenna, you good too? Anything you want to add?
Nope, the cases have been set out and they should be good to go.
All right, perfect. So without further ado, then let's get started with our first speaker. We're very excited to have Jeffrey Gross, Dr. Gross, join us. He is a former fellow, actually, many years ago, who I believe was in this course, which is very exciting for Wendy and I, but is now a very accomplished radiation oncologist at MSK, Memorial Sloan Kettering Cancer Center in New York. And we have asked him to start off the day by speaking to us, recognizing that many of us are not radiation oncologists, but giving us a little bit of a primer on some of the intricacies and the considerations that we need to think about for our fertility preservation patients undergoing radiation therapy. So let me stop sharing, and I'm going to turn it over to Dr. Gross.
Hello, everybody.